It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. Jim Knox along with Great Sales. Welcome back to another edition of the Best Docs Network, featuring some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives.
That's right, Jim. And up first on our show today, we're going to hear from facial plastic surgeon, Dr. Yadro Ducic. So before I met Dr. Ducic, I just felt like my skin was dull and spotty and splotchy, and was constantly trying to search for makeups that would make a difference transitioning into my 50s.
Skincare is obviously very, very important. The skin is what everybody sees. They don't see the underlying bone. If we do somebody's rhinoplasty, they're not looking at their cartilages, they're not looking at their jaws, their cheekbones, their eye sockets. They see the skin. That's the first thing that you see. So ideally, you want the skin to look as good as possible.
Typically, Dr. Ducic does like me to see patients before they have surgery. He'll do a consultation and he'll send me in the room and say, please talk to them about skincare. Let's get their skin looking good first, and then we'll, discuss surgery.
I always feel at home with Jennifer. She is a very well-versed in skincare, and she pays attention to my age, and we stay really focused on what it is that I'm trying to accomplish.
Well, the whole point of doing cosmetic surgery on somebody is to make them look better and feel better about the way they look, and more comfortable in their own skin, so to speak. And so one of the first things we always try to do is tune up the skin, make the skin look as good as possible, because then people oftentimes are so happy with their skin that they don't feel like they need to sometimes even do surgery.
As you get older, your body you lose the collagen in your skin. Collagen's kind of like the springs in a mattress. You start to lose volume, and you'll start to notice fine lines and wrinkles. By stimulating the collagen, your skin will become firmer and the wrinkles will start to dissipate. There's several different things that we offer that help stimulate collagen, one of them being the Dermapen. It creates micro injuries to the skin, and when the skin starts to heal, it starts to rebuild collagen, which is pretty amazing.
And the goal is not to do surgery, the goal is just to make somebody look better.
I no longer have to search for makeups that cover up. I just feel younger than I thought I was going to feel in my 50s, and just feel brighter, and that my skin finally is at a place where it's glowing.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market.
My specialty of prosthodontics really is the plastic surgery of dentistry. And in order to have a successful outcome, we want our patients to look beautiful and refreshed like the plastic surgeons do, but we don't want anyone to focus on why that is. And my specialty of prosthodontics exists because we make people's smiles as perfect as possible. We make people's smiles perfect with veneers, crowns, or implants. Each patient has a tailor-made treatment plan that we execute to give them the smile they've always wanted. It's very profound, the effect that teeth have on a person's facial structures. Part of the aging process is that people lose teeth or they lose bone, and that changes their facial shape, and it makes them age prematurely. So healthy, beautiful teeth support the face, and that is a part of what we try to do. For our patients who are missing teeth, we certainly want to give them back a beautiful smile, but part of the process is giving back the fullness and the youthful appearance from having the soft tissues restored as well as the teeth. During our diagnostic phase, we try to identify the problems with each patient's smile. Some people's teeth are too long, some are too short, some are too narrow, some are too wide. So there's a variety of ways that we can fix virtually every smile. And part of the specialty of prosthodontics is to know the modalities that need to be employed to fix each patient's smile and make it a custom, beautiful smile. My approach to these treatments is that I want to partner with my patients to create a breathtaking, functional smile. And the end result is life-changing for them. But what I love is it's life-changing for me too. To see their reaction and to participate in that, it's life-changing for me as well. I think most of our patients who go through a smile transformation have greatly improved self-esteem. And that's one of the most satisfying parts.
Did you know that blueberries can help improve your memory? Consuming blueberries helps to improve your memory by protecting your brain from inflammation and boosting communication between your brain cells. On our website, bestdocsnetwork.com, we have a map that can help you find the best doctor that's closest to you. That could be our next doctor. It's plastic surgeon, Dr. Robert Wilcox.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient, and the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago I came up with a new idea, no scar at all on the chest, no drainage tube. We're able to remove the two components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are two instruments that allow us to do it. It's the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery in 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op, or we see them 6 weeks after that, 3 months after that, and they're delighted.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys. Do you have missing teeth, need crowns, veneers, partials, dentures, or a full mouth reconstruction? Prosthodontist Dr. David McFadden will give you back the youthful appearance and confidence you deserve. Backed by credibility and credentials, Dr. McFadden is cosmetically changing his patients' lives one smile at a time. Call today or log on to dignitydental.com.
DFW.com. Dr. David McFadden, your go-to dentist in the Dallas-Fort Worth area.
To find a doctor on bestdocsnetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you.
The two major groups of acne population that we see in our practice are teens, which is, I would say, about 60–70% of our acne patients are in their teens. And then about 30% of our acne patients are adult onset acne. These are people in their late 20s or 30s or even 40s.
My dream was to always become a model, and you know, just dealing with acne, it's just like it affects me mentally, and it brought me my insecurity problems. And when I first met her at an event, you know, she told me, you know, it's okay, you're gonna feel beautiful one day. Whatever you feel right now, it's not gonna last for a long time.
Alexa is in the group of teen acne patients. She's had acne since her early teen years, and it's continued in her early 20s now. She has been treated in the past with multiple different types of skin treatments and medications as well. Typically what happens with her and most teens is that antibiotics or any topical acne product seems to work for a few weeks or a few months and it stops working. And that's the nature of acne, unfortunately. That's the nature of this condition. After patient evaluation and figuring out what type of acne they have, the treatment is tailored to address that particular patient's needs. In her case, we may use a combination of in-office procedures, antibiotics for a short period of time, and an anti-testosterone medication to reduce her testosterone sensitivity, and that's what has led to such great results with acne control in Alexa.
You know, I felt like an ugly duckling, like people were gonna judge me and see me like, you know, not as pretty, because nowadays it's all about image. You know, you wanna feel beautiful.
In my patients themselves, I see their personality change when their skin starts to improve. I mean, I've seen patients who are so shy that they avoid groups and crowds, and they're antisocial almost, and their personality completely blooms when you improve their skin and appearance.
Today now, I feel a lot more confidence, and she's like done a wonderful job. I see a change, a big change now, especially from my before and after pictures. I feel like I can talk to anyone face to face. I feel like accepted. I feel like a swan.
A recent study in the Journal of Periodontology shows that 2 ounces of yogurt a day may protect you from gum disease. The typical container of yogurt holds 6 ounces, and the good bacteria in yogurt helps fight germs in your mouth.
Welcome to the Best Docs Network. In the studio, we're very pleased to be joined today by one of the top LASIK surgeons, not only in the Dallas-Fort Worth area, but in the country, Dr. Harvey Carter. Dr. Carter, thanks for being with us today.
Thanks for having me.
It's a pleasure. And now talk to us about how you started in this field.
I chose this field of medicine because I loved microsurgery, and I found that out very early in medical school. And ophthalmology is an incredible mix of microsurgery, laser surgery, and wonderful, wonderful technology.
And you did your undergrad at SMU. Did you always plan to come back to Dallas to start your practice?
Yes, that was my goal. I came to SMU because of the pre-med program back in the time that we went here, and then went to LSU Medical School in New Orleans. Then did my internship back here in Dallas and residency in Georgia, and then back here to Dallas again. So I love Dallas.
That's great. And you have a lot of ties to the community, very involved in the Dallas community. You're the official LASIK eye surgeon of the Dallas Cowboys. That has to be both exciting and very rewarding.
That's been an incredible journey, and I sort of fell into that.
Really?
Went to a charity event many years ago. And while we were there were a number of Dallas Cowboy players there. And one thing led to another. And first, Tony Casillas' wife came in and had LASIK surgery. And then Tony Casillas came in and had LASIK surgery. And then I think it's like 50 or 60 Cowboys over time came in and had LASIK surgery.
That's so fun. And what would you say sets your practice, Carter Eye Center, apart from other eye practices in the Dallas-Fort Worth area?
I really think it's personal service and high technology. Patients, I think, are looking for personal service, and at the same time, I think they're looking for high technology. They want the latest, greatest, they want the best.
To see the rest of this interview, as well as other outstanding videos, head to bestdocsnetwork.com.
For more information and to watch hundreds of videos on the amazing doctors that you see on our show today, head to our website. It's bestdocsnetwork.com.
BestDocsNetwork.com is all about doctors helping change people's lives, like our next best doctor, that is cosmetic dentist, Dr. Guy Lewis.
For years, I've been very self-conscious about my smile. I took some antibiotics as a teenager, and that permanently discolored my teeth. I tried bleaching professionally, I had tried in-home bleaching, tried buying stuff off the internet, everything I could think of, and nothing was working.
On her, we did the crown lengthening and gingivectomies to take the gum up, and then we did veneers across her upper and lower teeth, and then in the back we did crowns because they were kind of broken down and needed restorations. And we opened up her bite, and so it gives her a more youthful look. The whiteness of her teeth, you know, made her look great. It was just fabulous what it did for her.
Before I had my smile makeover, it affected even how I took pictures. You know, just in a social setting, somebody's snapping candid shots, and I would never, rarely would open my mouth to smile. You know, once I had the smile makeover, I'm just splashing the pearlies.
What I love about what I do is that it changes people's lives. It sounds kind of corny, maybe a little melodramatic, but people who have had a smile that they aren't happy with and that have been conscious of it their whole life and try to hide it, then you take that away and make it to where they can smile and they feel confident about their smile and confident about how their teeth look. It changes their life.
I think it was October when I had the final visit. That Christmas, I went to my brother's, and my mother was across the room from me. My mother's 82 years old, and she looked at me and she said, "Your smile is dazzling." And I was like, "Well, thank you." Before I came to see Dr. Lewis for my smile makeover, I was always self-conscious, a little fearful about trying new things or stepping out of my comfort zone, and after I feel like I can take on the world. I would just say that if anybody's considering a smile makeover with Dr. Lewis, they should go for it. Get your consultation, get in, you'll be happy.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
There are a lot of over-the-counter medications and a lot of decisions you have to make when you're standing there trying to figure out what to do. First of all, brand names are not that necessary. Usually right next to the brand name medication is the store brand, and they're just as good. Just look for the chemical names. Avoid megadoses of medications. Those can be bad for you, really bad in some cases. If you're on a lot of medicines from your physician, especially blood thinners or high blood pressure medicines or diabetes medicines, you got to be careful what you get over the counter because it may act against your usual medications. Ask the pharmacist or ask your doctor. Kids under 6 probably should not be taking antihistamines and decongestants. There's a lot of good stuff for pain over the counter, but you can use ibuprofen, naproxen. Acetaminophen is great for fever. There's lots of rub-on balms and things for muscle pain. Those really don't work very well, so I kind of avoid those. And just take acid medications if you want, but only 7 to 10 days, not month after month after month.
For additional medical minutes from Dr. Honecker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
I've experienced in my past excessive weight gain. I would diet, lose, gain, lose. I was embarrassed. I was ashamed. I didn't feel good, and the more I gained, the less I felt confidence. I had made the choice that I needed to really make the decision to change my life, to get my health back on track.
Charla had a lap band procedure, which is one of the most common procedures that we do. She's been very successful for her. She lost her predicted weight that she wanted to, and the several different medications she took, she doesn't take anymore.
I decided to have the bariatric lap band at my Bariatric Solutions. I have a lot more energy. I strive to do things that I wouldn't have before, experience some exciting things on some of my travels.
A band is put in laparoscopically through small incisions in the skin. We put the band around the top of the stomach, and it's a balloon, essentially. It has a port that goes up under the skin, and we can put salt water in there and tighten the band up. That keeps the food in the top of the stomach and makes people feel not hungry with a small amount of food. It works like a long-term diet, only you feel full with small amounts of food. The most important part of a band patient doing well is frequent follow-ups and getting their band adjusted, especially early on. First 6 months, we will normally do about 5 adjustments until they learn how to use the band. After that, maybe one every 6 months, and then later on, maybe once a year.
My experiences with Dr. Stowers and his staff is so easy. I arrive, I'm seen in a timely manner, in a professional manner, and people are so friendly and they treat me as a family. Each time is very special, and I look forward to seeing the doctor. He's very friendly, very cordial, and very professional all at the same time.
Best Docs Network doctor and official eye doctor to the Dallas Cowboys, Dr. Harvey Carter, the expert for all your vision needs. See the world differently in only a day. Specializing in LASIK, cataracts, and crystal lens. Visit Dr. Carter today for the ultimate eye experience. Call now and receive $2,000 off your LASIK procedure. When seeing is believing. Dr. Harvey Carter, the official eye doctor to the Dallas Cowboys.
Imagine designing your own perfect face and body. Turn to Dr. Robert Wilcox, who specializes in face and body procedures, as well as many non-surgical alternatives. Dr. Wilcox understands that your life and appearance matter most. With an extensive educational background and exceptional eye for detail, you can now look as young as you feel. Call for a complimentary consultation and regain your confidence today.
For more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com. That's bestdocsnetwork.com. Speaking of best doctors, how about our next best doctor? One of the tops as far as plastic surgery goes in the Dallas-Fort Worth area. It is plastic surgeon Dr. David Azouz.
I never intended to have a facelift. However, I had married a gal for several years, and during those time I gave her lots of plastic surgeries. And then I found out that she had, after she left, she actually got remarried, and a fellow showed me her picture on Facebook, and she looked, at 55, she looked absolutely wonderful. Just really good, and I thought to myself, you know, if I could pay the money for the plastic surgeries for her, I bet you I have enough money to pay for it for myself.
John is a very intelligent gentleman who was close to 70 years of age, and he wanted facial rejuvenation surgery, but he wanted a very natural look. He didn't really want to necessarily look that much younger. He wanted to look rested, and he wanted to look good, and that's what he was after, which was very realistic for a gentleman who's close to 70 years of age.
It is unfortunate that more men do not choose to get a facelift because it makes a tremendous difference in their appearance. They get their chin back, they get all the wrinkles taken out of their face, and they look younger, and obviously they're going to have more respect when they're younger.
There's many actors and other prominent figures in our community where the males have had facelifts, and they look like they've had a facelift. They have almost an unnatural look. In a gentleman, you have to be extremely careful because if you make him unnatural, you tend to feminize him. And I think the last thing a male wants is feminization of the face. They just want rejuvenation of the face. So I believe that we were able to achieve all that, yet giving him a very natural look to the point that he doesn't look like he's had facial rejuvenation surgery.
The surgery has given me a confidence to put myself on some of the dating services, the .coms, and the results have been excellent. I've probably had a different date at least once a week, maybe sometimes twice a week. And the number of people responding to me, I realized that they were younger and younger and younger. And typically the people that respond to me are aged somewhere between 50 and 55. And that's not bad for somebody 68. I'm very, very pleased with that.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Sitting in an office chair all day can be tough on your joints and can cause knee pain. In order to ease the pain, be sure to stretch your legs straight out and tighten your quadriceps 5 times for about 10 seconds. This will help to lubricate those knee joints.
I had augmentation done that went wrong. It was really, really bad. And I was a fitness instructor and I've been teaching for a really long time. And I stopped because I was so cognizant of the humongous size that I had become, which is fine for those who go to get it. That's fine, but if it's not me, it's really messing with my psyche.
Janet came to see me because she needed some revisional cosmetic surgery. She had a particular breast deformity where it's called capsular contraction, which is basically the breasts are turning hard around the breast implants. And her breast implants were basically stuck all the way up inside her chest, and she had a lot of cleavage, and it looked very unnatural.
And I said, I can't continue this, Dr. I really didn't want to go under the knife again, but I think I have to because I can't continue to live like this. And his suggestion was, Janet, let's get rid of everything. Let's get you healed. Let your skin retract. And then, after a few months of that, let's go back in and do what you originally wanted done.
I had to do a couple of staged procedures for her because it's hard to do everything at once, and it's safer that way. If you try to rush surgery, especially revisional surgery, you can have problems. What I had to do is I had to first take out her implants. I had to do an explantation, okay? So that was the first stage, and do a mastopexy. So basically we took her breast and took them back to normal. After a series of several months later, when she healed up, I came back and I re-implanted some new implants, put them into a different place, and I did a tummy tuck on her and some liposuction. So it really made her look really good, and she is really happy today. It's a huge change and a huge difference. You can just tell that her overall personality's improved significantly.
It's been incredible since then. My life completely changed. I'm happy. I'm actually more confident, I think, than I've ever been because I am the way I am. I'm out, and I'm actually thinking about going back into fitness. Dr. Thornton's changed my life significantly, and every time I see him, I tell him that. You're like my savior. You changed me. I am this happy 46-year-old woman that I owe him a lot.
That'll wrap up another edition of the Best Docs Network, featured some of the best doctors in the Dallas-Fort Worth area that help change people's lives. And for more information about any of our outstanding doctors you see on today's show, head to the website, bestdocsnetwork.com.
And if you have a question, a comment, or a life-changing story, we would love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.